10 years of daily headaches, not just ordinary headaches, headaches so severe, cannot get out of the bed, writhing in pain, left college education, entire family being shattered because of his condition, lots of financial loss, complete psychological breakdown. This headache has been treated in 6 institutes of national importance, 15 to 20 neurologists, 2 major brain surgeries, multiple nerve blocks, multiple steroid injections, 10 shock treatments for severe mental depression. What are we dealing with? Ladies and gentlemen, my name is Dr. Praveen Thomas. I am a headache neurologist.
My name is Amardeep. I came all the way back from Patna, Bihar. I am diagnosed with chronic cluster and trigeminal neuralgia. Previously, I was treated in Patna hospital and Delhi also. I was suffering from severe pain, mainly in the face. It was coming like shocks, originating from here to like here in the jaw. So it was like shocks, electric shocks, like pain that is keep coming and going. It was very painful. There was like no abortive or anything working. There was nothing that can stop the pain. So after the diagnosis that was made in Patna and Delhi, I searched on the social media about Dr. Praveen Thomas and Narayana Hospital. I consulted him on Zoom meeting, and he told me to come here for treatment. Previously it was very bad. All the shocks that I was getting were very severe pain, feels like stabs coming and going, and the back of the head, it was also there where the surgery was made twice. After coming here, I was in severe pain and they started the treatment immediately. Dr. Praveen Thomas helped like instantly. That the day I came here, he started all the treatments and everything. And at that day, I was in very severe pain. But the treatment that he gave me that day worked, like it stopped the pain. And from that day, the treatment started. I came here on 21st February, and I'm now I'm like more than 90% pain free. Everything that is given in the hospital and all the doctors that treated me working very well. The hospital itself is like very good. All the medication that was previously given to me explained that what are the effects of it on my body and everything. The Dr. Praveen Thomas started new medication and explained me that which medication is doing what, and explained me clearly that how it will affect, and the diagnosis was made. The diagnosis that he made is cluster tic syndrome, which is basically cluster headache that is basically in the eye that feels like stab, continuous stab, and you have to like push your eye like this to feel relief. It's a very severe kind of pain that is like continuous for like 1 hour or so if you don't get like any relief, mainly oxygen. So, and the second thing that I get is mostly the electric shocks in the face that originates from here to here. Both are very severe, and previously I wasn't getting any long-term relief from this disease. It was basically that they were giving me steroids and everything, but it wasn't lasting long. So here Praveen Thomas gave me treatments that helped me. Because this pain is like invisible, people doesn't really understand how much painful it is, because they usually don't saw it clearly, like what is happening. Only we can do like this and they can understand, but they usually don't. So here Dr. Praveen Thomas clearly understood my problem, that what is going on, and on the basis of that he did medications and procedures that helped me a lot. This disease is like very rare and very hard to like find doctors who really understand this. I am suffering since like more than 10 years, continuously since it started. Before 10 years, it was like it keep on increasing, and there was no clear diagnosis that were made, and they also did 2 surgeries, but there was not much improvement with the treatment that I was getting. Now it's much more better now. I'm more than 90% better, and the pain is like not there. So I am very thankful for Dr. Praveen Thomas and NH Health City for providing me all the support and the care and the treatment that I got here and make me pain free mostly.
This condition is called cluster tic syndrome. You should understand that this is a combination complex headache disorder. This has a diagnosis of cluster headache, trigeminal neuralgia, SUNCT, SUNA, occipital neuralgia, and epicrania fugax. So you would be hearing some of these terms for the first time. To simplify it, I will tell you, cluster headache is a type of headache disorder because of a disorder inside the brain. And this causes severe pain around the eyes, as if someone is trying to pluck the eyes out, or as if a hot iron rod is being jabbed into the eyes. And this pain can last for hours, with some red eyes and watering from the eyes, or blocked nose and watering from the nose. There is another type of pain called trigeminal neuralgia, and this constitutes shock-like pains on the face. It can be around the eyes, it can be around the cheek and the jaw. Along with this, there is a condition called SUNCT, which is like feeling like multiple needles being poked into the eyes, and this also leads to watering and redness of the eyes. And there is a condition called SUNA, which is a variant of SUNCT. And then there is also neuralgias, which come as sharp shooting pains from one end of the head to the other, or one region to the other. This is called also as epicrania fugax. So this gentleman had to endure all this in the last 10 years, and he's gone through a huge crisis, and he was completely shattered. I'm glad that I was able to do treatments which were effective in his case. And the most important message that he himself has actually said is that there is hope. There is light at the end of the tunnel. Not lose hope. The reason why he lost hope is one point when a doctor actually told him there's nothing more which can be done. And that is from a very big hospital, a very reputed hospital, and a very reputed center for dealing with these kind of conditions. So that really shatters patients. It is always good to know that there is always something else, and never to lose hope. Always have that little hope. It should just shine somewhere which keeps you going, because there are a lot of people who lose their lives because they feel that nothing more can be done. I think that's the most important message. And of course, these kind of complex headaches are managed over several days with certain medications and injectables and certain minimally invasive procedures. So it's actually a combination of various treatments which are available, which are scientifically very advanced, that we can give for these kind of patients, and then they have a wonderful improvement. And as we see in the case of Amardeep, and once again, to just give a message to everyone out there: cluster headaches, chronic cluster headaches, daily cluster headaches, refractory trigeminal neuralgias, those don't improve with medications, injections, and surgeries. And these chronic Sankt Suna crisis, where you do not know what to do, medications are not working, nothing is working. These conditions have very effective treatments which need to be tried out. And when I say it's not just one treatment, there are several of them. So each person has to have a tailor-made treatment after a detailed understanding of the illness of the person, after a thorough medical examination, after the necessary investigations, and it has to be formulated for a person, and that has to be continued for a while. And thank you very much, Amardeep, for your kind words, and to his father as well. And I'm glad that there has been a significant improvement, and you're now having a headache freedom where you could just move around without pain and get back to have what could be considered as a normal life. Thank you very much.
और हम लोगों से जो इस तरह से पीड़ित हैं उनके गार्जियंस से रिक्वेस्ट करेंगे और अपना अनुभव शेयर कर रहे हैं कि वे यहाँ आएँ और इलाज कराएं, क्योंकि ये क्यूरेबल है और इसमें घबराना नहीं चाहिए, होपफुल होना चाहिए। थैंक्स।